Good morning, everyone. Thanks, and welcome to BoSTEM Virtual Career Chats. As you know, my name is Louis, and we are here learning about career pathways in the STEM fields. If you're a student joining us, welcome. Thank you so much for taking the time to listen in. You're in for a treat. If you're interested in STEM careers or any STEM industry, listen closely because we're going to teach you a couple of tricks and tips about how to navigate the STEM world and create a pathway for yourself. If you're an educator listening in, thank you for being an ambassador for the BoSTEM program and advocating for STEM growth. We cannot do this work without you. Similarly, volunteers, if you're tuning in to kind of check out similar STEM chats like this one, we highly encourage you to pass the word along to your friends. We cannot wait to see your STEM chat to kick off. But without further ado, let's get into today's session. Students, as you know, STEM chats are really centered around insights around what it's like to pursue a career in STEM. Today's guest is from a company that's fairly new to the BoSTEM family, so I'm gonna give him the chance to introduce himself and talk about his work. But without further ado, please join me in welcoming Alec. Alec, welcome.
Yeah, thanks for the introduction, Lewis. I'm very excited to be here. So my name is Alec. I work at Harvard Pilgrim Healthcare Institute, which is an appointing department of Harvard Medical School. And we do a lot of public health research to push initiatives that help with children's health and mothers' health across the nation. And prior to that, I was doing a bunch of research in college at University of Massachusetts. And it was more so focused on the human-animal bond. And that's like what piqued my interest about research. And I'd be more than happy to jump in on any of which experience.
Awesome. Great. So students, as you know, we're here to talk about Harvard Pilgrim Health Insurance, healthcare. So Alec, what was it like to kind of be, inspired to pursue a STEM career? When did that happen for you? Was it really early on or later in your education?
Yeah, so I knew that I always wanted to pursue healthcare since I was in high school. So when I was in high school, I was training to be a parkour athlete, which is like kind of like gymnastics, if you know what that is. And I tore my meniscus, which is a pretty not super severe injury in the grand scale of things, but I had to get surgery and I was out for about like 7 weeks. And during my time, I was able to experience medicine firsthand. And through the collaboration of physical therapists, physician assistants, and other doctors, I became stronger mentally and physically. And I was like, I want to help people in the same way that doctors had once helped me. So one great way to get your foot in the door of medicine is by doing research. So a lot of doctors and physician assistants, they pursue a career clinically. So that's directly working with patients. But beyond working with patients, they do research. And what the research hopes is like to help the greater population. So when you're working with someone clinically one-on-one, you're focused on an individual. But research is typically focused on population level. And that's something I'm really interested in. I love working one-on-one with people, and I think that's one of the best things about medicine. But another great thing about medicine is being able to focus on the health of a population. And so in college, got my foot in the door with research, looking at behavioral economics, which basically is what kind of things influence how people think. And I joined the lab where I got to work with a professor where we studied the human-animal bond and how that impacted stress, depression, so on and so forth. And it was really cool being part of kind of a startup lab and working directly with a professor and recruiting participants, scheduling participants, retaining participants, and also just seeing how pairing them with a dog impacted their health mentally and physically. And I would highly encourage anyone who's interested in science, get involved with research because it's very cool to be able to work directly with an investigator. And also it's just a great way to get your foot in the door for medicine. A lot of medical colleges, physician assistant colleges, nurse practitioner colleges, even PT, physical therapy schools, I love to see research experience. And what I would encourage is just take initiative and try to make that connection with a professor in a field that you're interested in.
it sounded like you got inspired to, pursue research in the high school years. Were there any classes for you, Alec, in the middle school or any earlier years that might have said, huh, there's something here. I should,
Yeah,
continue digging here.
yeah, I remember one of my favorite classes in middle school was sixth grade, and it was my first science class. And that was when we started learning about biology and cells and DNA. And I just thought it was incredible to learn what inside my body is influence everything going on outside of my body. And I think it's absolutely fascinating. And there's plenty of ways. I know in middle school and high school that you are required to take science courses, but there's a lot of really cool ways once you're onto higher education, or not even higher education, where you can pursue things specifically that you learned in middle school and high school. So for example, in middle school, we did a lot of pipetting with just
Mm,
random chemicals and stuff. And I always thought that was really cool. So in college, I made sure to try to take some chemistry classes. And there's a lot of industries out there um, that really need scientists with those kind of foundational skills. So if you like a science class, I would just encourage you to keep going with it and continue to pursue it.
absolutely. Lots of opportunity here, students. So really
Hmm.
interesting to hear that biology and, research was that connection for you. So, Alec, you were a student, kind of wanted to pursue research. What was it like to kind of graduate from high school and, go into the college, environment? Um, what was it like to kind of make that decision? Did you have any supports? I just want to highlight the transition from school into, college or even the workforce. What was that experience like for you, and how can some of our students kind of prepare themselves if they're, in the similar footsteps?
Yeah. I in high school, one support that I had was a teacher, and I think one great thing that all high school and school students can do is find a mentor or someone that can help them with the process. Because teachers, obviously, they're there to teach you whatever the material is, but they're also there to empower you and make sure that you are going on to the next step and you're pursuing your passions. So I had a teacher who really believed in me, and through many conversations talking about what my interests were, where my passion lied, they told me about like specific schools and specific programs that I should be applying to. um, the transition itself from high school to college can be overwhelming depending on your personality type, but also it's extremely exciting. And same thing with going into the workforce. You're going into a completely new environment with totally different people and different objectives, and it's going to be a different workflow, and it's going to be a complete different reprioritization of how you're going to spend your time. But it's also extremely exciting. It's a great opportunity for growth individually and professionally. And so I went from a small high school to a university that had 30,000 people in it. So it was really kind of overwhelming at first to see everyone in my proximity be the same age and have similar interests and goals as me. But also it was really exciting because I made a lot of really good connections with friends, with professors. And I think because of um, college, I'm at where I am today. And I feel like my ambition to become a healthcare professional is even more strong. Mhm.
Yeah, super important. That network and just trying to learn from others is so, so key. Community is something that we kind of reinforce here in Boston by just, communicating to students that the STEM community is so welcoming. They want diverse perspectives. They want different experiences. They want people from different backgrounds to kind of come to the table because it stimulates really good conversation. It makes me think about, Alec, a time where you might have faced a challenge. What kind of supports or skills did you kind of lean on to help you overcome those challenges? I'm thinking something like a new school, or walking into a class that's really challenging and you're having to, find different supports to help you be successful. I say that because, we know science is not easy, as though it
Mhm.
can be very, very interesting. There are some challenging
Mhm.
moments, but that's not to say that it's, all and end all be all. Could you highlight any of the supports that you found to be helpful during your time studying?
Yeah, absolutely. Science, I'm glad you mentioned science is really hard. It's really fun, extremely interesting, very rewarding, but it's really hard. And in college, there was a class that I particularly struggled with, organic chemistry. That's talking about like the micro level stuff, the chemical reactions that happen in your body that make everything function. And so it was a really hard class for me. So what I would do is there's a teaching assistant and a supplemental instructor, and after every class, I would go and talk with the professor, and then I would also attend every single supplemental instruction lesson. And I think that if you are struggling with something, you just have to take it upon yourself and use the resources around you to help you get to the place that you need to be. So many people in college and are there, and in the workforce are there to help you, and they want to see you succeed. It's just about taking the first little step to asking for help. And through asking for help, I was able to do well in the course, but it was really hard. But like it was just through working with others and using a support network to make sure that I succeeded.
So, so important. Thank you for highlighting that.
Mhm.
Really key. All right, so students, we're hearing a little bit about what it was like to be a student going into college. If you're a high school student and you're getting ready for that transition, really listen closely because Alec is highlighting some things that I feel like can help you along your transition. Alec, you're in the professional space now, doing research as a, research participant. No, what would you consider yourself in that
Hmm.
role? You wouldn't be a researcher or a research assistant. Help me clear that up because I think it's important for our students to understand as
Yeah,
well.
yeah, absolutely. So one of the like gateway jobs from research in college, undergraduate education into the professional setting is becoming a research assistant. And a research assistant is a very, very broad term. So you can be a research assistant for like geological studies if you want to study rocks. You can be research assistant clinically if you want to work directly with the doctor and see patients and work on finding specific items related to diseases. I'm a research assistant in a longitudinal health study. So that's the fancy way of saying that the investigators have been looking at the same participants for the past 20 years. So they're looking at specific health outcomes from when moms were pregnant to when their kids, the same mom and kids, are now, the kids are 20 years old and the moms are around 50 years old. So they've been looking at the same pair and they're looking about how the environment, jobs, school has impacted students' physical and mental health. And so what I do in my day to day is I get to schedule participants for visits where we do data collection. And what the data collection entails is they're about 4 hour visits. We go through a consent process just to make sure that the participants are fully aware of what they're participating in, where their data is going, and how we are using their data. And then we go through some clinical measurements such as height, weight, blood pressure, some blood tests, and then we do some qualitative work with questionnaires, so asking them about their home, health, and behavior. And this is my favorite part of the job. It's extremely rewarding to be working directly one-on-one with participants, focusing on relationship building, connecting with individuals from diverse backgrounds, and just hearing about their experiences. One thing that I really enjoy and why I'm pursuing healthcare is just being able to work directly with people and learn from them. So I would highly encourage anyone to get into research, to work on behind the scenes, to figure out how to solve big public health issues, but also being able to like get into the nitty gritty and working directly with people.
I love that. It just shows the intersections of all the different fields
Mhm.
available right now. So students, if you're interested in research, if you kind of resonate with what Alec is highlighting here, maybe research might be a place for you. If you find yourself to be um, a great organizer, coordinator, or just someone who's really, really interested in seeing what happens after a certain amount of time with different outliers and controls, please continue to, pursue that interest. Alec, we highlighted the fact that you were a student transitioning into the professional research assistant role. What's next? Someone who would want to follow in your footsteps. What would kind of be the end goal, or what would be the options for next steps?
Yeah, great question. And this is one of my favorite questions. And the reason why it's entirely up to the individual. That's the beauty of research. So um, getting the research is like so broad that you can actually do almost anything after. So if you want to go into consulting work, you can go into consulting work. If you want to pursue a master's in public health, you can go and do that and become like an epidemiologist or someone who studies diseases. Or you can go the clinical route, and that's the route that I chose. So what's next for me is this fall, I'm going to be attending a physician assistance program, which I'm really excited about. And physician assistants are mid-level practitioners. So they're not a doctor, but they're not a nurse, and hence the mid, they're right in the middle. And what physician assistants do is they diagnose patients, they treat illnesses, they prescribe medication, and most importantly, they get to work one-on-one with patients. And one thing that's really exciting about the physician assistant role is that it's extremely flexible. So for example, say you are interested in going into primary care and working directly with people, helping a very diverse patient population, so babies to older patients, you can go ahead and do that. But say after 2 to 3 years, you're like, during a clinical rotation in school, I really enjoyed surgery. You can just apply for a job in surgery, get trained in surgery, and then help doctors with patients that need any surgical procedure. So you can jump clinical fields as a physician assistant, and that is something that is unique to them, which is really exciting. And also one thing that I really enjoy, or I hope to enjoy about the PA profession, is that they are known for spending large amounts of quality time with their patients. And that's the most important thing to me, is that relationship building and working directly with individuals. And the physician assistant profession is actually kind of new. It was founded in 1960s. So it's only been around for about 50 to 60 years, and I'm sure it will continue to grow. So if you are interested in becoming a healthcare professional, but you're not necessarily sure that being a doctor is the right route for you, because being a doctor, unbelievable work, but you have to go through 4 years of medical schooling, then you have to go through 3 years of residency, and then you have to go through an additional year of fellowship. So that's 8 years of education, which is unbelievable. It means you're very specialized. It means you can help anybody, and it's awesome. But if you're thinking that you want some flexibility, you want to be in school for 2 years, and you want to be able to work with patients, I would highly encourage researching the physician assistant role and scope of practice.
That was super, super helpful. Oh my gosh, I didn't even realize the differences between clinical and working with patients, and all that difference is so, so cool. Students, I hope that we've hit the nail on the head here when it comes to pursuing a STEM career, specifically in research. So as you know, Alec is highlighting here that research is definitely a safe space to kind of enter if you're not really sure where to go. I'm pretty sure, Alec, you're gaining a lot of different skills and knowledge and insight, and of course, making great connections to help you kind of solidify that decision. So now your, passion to be a physician's assistant is similar to someone that might be wanting to interact with a patient, like you mentioned, or be in a clinic, in a clinical setting, doing hands-on work. Super, super inspiring. But then I just want to highlight that our students who might be a little bit more introverted, who might not want to do a lot of these social interaction and do a lot of behind the scenes stuff, research might be another space for you. Consider doing that. Alec, would you say that a PhD track is in line with this career?
That is actually the direct track. I'm surprised I didn't mention it. So if you're in research, PhDs, masters in science, those are the typical routes that people follow. And typically what happens is if you're working with a professor in college, there's many options to stay with that professor to pursue a master's and PhD, or you can jump universities, jump colleges, and continue to get a master's and write a thesis and something else, and then move on to a PhD. But that is absolutely the space for it. Yeah, and like you said, I'm glad you mentioned that you can be extroverted or introverted in research. You can work directly with patients or participants in research if you want, but you can also, do lab work and work with cells or work with animals or research is so broad, and I love it because there's research needed in every field. There's research in economics, there's research in psychology. So if you're interested in any subject, there is going to be a need for research in it. And I think I would encourage my friends, my family, and all of you guys to get into research because it's a great space for everybody.
Awesome. And honestly, if you ask me, research provides some really, really cool insight. I mean, you're mentioning the bond between humans and animals in therapy. I mean, that's super important, right? I mean,
Mm-hmm.
we don't think about those kinds of relationships or just that type of study often. So thank you again for providing us such great insight. Alec, we're nearing the end of our session here. We talked about a lot. We talked about what it was like being a student, transitioning out of the academic space into the more professional space, and now we're even highlighting future tracks that students can kind of explore. What would be your kind of closing advice for someone at home listening to a STEM chat and saying, "Wow, this was super helpful. What can I do next? What should be my next step?" What would be your advice to those students?
Yeah, I would say just try to highlight, whether it's through taking notes or thinking about what interests you, because I guarantee there's going to be some application of what your interests are. And after you kind of iron out what you want to pursue or something that you maybe just want to dabble in and just like play around with, then I would just start to look up online, like what are careers involving, X, Y, and Z. And then once you have somewhat of like a background of what you can do, it's just about taking the steps to pursue whatever that goal may be. And like I said, with teachers and your classmates, uh, a lot of people are there to empower you and make sure that you're succeeding in whatever your mission may be. So although it may be your goal, I would just say that use the people around you to find out to help you get to where you need to go. And I'm just speaking from personal experience and through working with my professors and my classmates and different doctors and stuff. They've helped me figure out what my goals are, and um, ultimately, I owe a lot to them um, for being where I'm at.
Super important. Alec, thank you so much again for your time, your insight, and sharing your story about what it means to be a STEM professional in the research space. Students, I hope that we've given you a nice enough picture to kind of understand what it's like to pursue a STEM career in the research space. If you yourself are interested, want to continue this conversation with Alec, or just love all the work that's happening at Harvard Pilgrim Healthcare, feel free to reach out to myself, your educators, and we're happy to continue this conversation offline or just get you connected to Alex so that you can really, dive deep into this industry. As we're seeing, there's a lot of flexibility, a lot of opportunity for folks to kind of apply their skills. And so if you're interested, we highly encourage you to take it serious because there's lots of success that can come from these industries. So without further ado, I just want to say thank you to you, Alec, for giving your time and sharing your story. Thank you, students, for listening in. We cannot thank you enough. This is why we're doing this important work. And thank you, educators, of course, for being that mediator and ambassador for the BoSTEM program and STEM industries overall. We know that the STEM education is not easy to pursue, but with supports, it can grant a lot of success for our students in the Boston public school system. So thank you, everyone, for taking the time to listen in today. Alec, any closing words?
Yeah, I just want to thank you, Louis, for having me, and I just want to give encouragement to any student out there. You can do whatever your mission and your dreams are, and I'm excited for all of you.
Great. Thank you so much, everyone. Thanks again, Alec, and I bid everyone a great rest of the day.